Hi, everyone. My name is Darlene Mahoney. I am your host of SeniorLivingGuide.com podcast. And today, I want to talk to you a little bit about SeniorLivingGuide.com, which is one of our sponsors. If you like this podcast, please be sure to visit us on Spotify, Apple Podcasts, or anywhere you enjoy your podcast, because we have tons of different topics that we've talked about for a little over a year. So that's pretty exciting stuff. And also on SeniorLivingGuide.com, SeniorLivingGuide.com is a resource for seniors and their caregivers to find senior housing solutions and home health care solutions as well. So you can go there and you can find those solutions in a easy to navigate one-stop solution. So definitely check us out. Easy peasy. Again, that's SeniorLivingGuide.com. And today we have in our studio our guests, Dr. Pam Trinetti and Janet Rooks. Dr. Trinetti is an osteopathic physician who specializes in geriatrics. Janet Rooks is a social worker and a dementia care specialist. They work together at the Parish Senior Consultation Center, where they focus on the care of patients with dementia. Dr. Trinetti is the Director of Aging Services at Parish, and Janet Rooks coordinates Parish Senior Solutions, which provides education, resources, and support for seniors and their caregivers. So we're going to talk a little bit today about something that I didn't even really know was a thing. So I'm kind of excited to deep dive into this, because I bet a lot of our listeners do not either. And it's MCI, almost dementia. And our topic is, do you have MCI? So what is MCI?
MCI stands for Mild Cognitive Impairment. It's this area between the normal memory loss of aging, because we all have some, and a true progressive dementia.
Yeah, and patients will notice that something's just not right.
Mm-hmm.
I'm struggling a little bit, or I'm having trouble kind of putting things together, or loved ones will notice it. Mom, this doesn't taste like it used to. Dad's having a little trouble with putting things together like he used to. Or the test will reveal it. Mm-hmm. Our tests we do in the office, our memory test, and or the TRAILS test. It just shows that they're not as sharp as they were. There's a little failing in some of those things. It's the mild decline in the memory.
So would you term that like a pre-dementia?
Its own entity now, because there are folks who notice a worsening of the normal memory loss.
Mm-hmm.
As we get older, yes, we put our glasses on our head and say, where did I put my glasses?
Mm-hmm.
We have the hereafter phenomenon. You run into a room and go, what am I hereafter?
Mm-hmm.
You go to see a movie, you forget the movie's name, but then you remember it later.
Right.
With MCI, there's just a little more losses. Families are noticing, there's some repetition. Mom or dad didn't show up for the birthday party. There's just these subtle changes mm-hmm. that indicate there's a problem. Mm-hmm. Now, it's true that 25% of people with MCI will progress to a dementia, a progressive loss of memories and abilities, and we know that there's 50 different causes of dementia: Alzheimer's, vascular, and then some of the ones we don't see as often, the Lewy body dementia, primary progressive behavior, and just dozens of others. But that means 75% of the people don't.
Okay.
So you can have MCI this year, and it could be the same next year, the next year, and a year after that, you start having problems.
Yeah.
Okay. So what are the symptoms? What do people need to kind of?
Well, you're forgetting things. Mm-hmm. They're forgetting it more often. They're missing appointments, whether it be doctor appointments or family get-togethers, or social events, something at church, something that they had planned, but they're just forgetting it. They have problem following conversations. So say, for instance, they're sitting in a room or sitting around a table or in a living room, and there's a few conversations going on. They have a hard time keeping up with those conversations. They make it agitated. Mm-hmm. So they have a problem with that. Movie plots. So where they used to watch a movie and be able to keep up with everything like that, they have a problem with those movie plots. So they've gone from watching movies to watching, sitcoms.
Sitcoms, yeah.
Sitcoms are game shows. They may give up the computer because it's more complicated. Forgetting those passwords. We have to change our password at work every few months. On your computer at home, forget those passwords. Or you on your cell phone or whatever, they'll ask, well, what's your password? I don't know. So that's what they may. Or they may change from a book to a magazine. So where they've been a book reader for years, they may read that same book over and over. And are they really reading the book, or are they just reading words? So they change to a magazine.
And decisions get harder. People feel overwhelmed with decisions or complicated financial matters. They can still do the checkbook, but the investments might seem too difficult, or the quarterly taxes, or other bills that come up every so often. Sometimes people are impulsive. They just make poor judgment choices. People with MCI are also at very high risk for scams. They don't identify that this is an untrustworthy person offering me this.
So how do you tell MCI from dementia?
The person's still functional. To a casual conversation, you'd never know a thing was wrong with them. They're paying the bills and cooking the meals and driving to the store, but there's something wrong. It's very subtle. They can't adapt to new things, unfamiliar things, harder time learning more information and retaining it.
Yeah, and as I mentioned earlier, family members may notice it, but they're also withdrawing from family. They're declining invitations to go to family get-togethers. Oh, I'm busy. They'll make up excuses not to go. Or they're showing up late or not at all. They're just not going. They're also a personality change. They're either getting irritable or they're just getting very, very passive. But a lot of times what we've seen is the irritability. Oh, they're just snappy. And just,
but you can get the snappy with dementia, though, too, correct?
Oh, yeah.
Okay.
Oh, yeah. We've seen that a lot. But, but the personality change would be just, Mom was always just very meek, and now she's using, words that we've never heard her say before. But she doesn't want the grandkids around, and just things are not, she's just different, and just not coping really well.
Yeah. And some of it, kind of what you're describing, sounds like depression. Can it get confused with depression, or is it related?
Well, it sounds like a lot of things.
Yeah.
So it could be a medical problem. There could be sleep apnea, which is not getting enough oxygen to your brain, and you're just not, you're
not focusing, you're not concentrating.
Yeah. It could be a thyroid problem. And, it could be medication side effects. Sleeping aids really affect someone. They're groggy in the morning. They're just not functioning. They're irritable. And we see that more than you would really believe. We see it a whole lot. It could be a combination of those two, and it really has a big effect.
Yeah, and even a lot of these things that we're kind of talk about can be, forms of anxiety as well. It kind of seems like
that's where making the right diagnosis comes up. But sometimes it's very hard to tease all these layers out.
Yeah, for sure. So what is the workup to, since you mentioned, thank you. Great lead in for my next question, Dr. Chinetti. So what is the workup to kind of figure out what's going on?
We always say, when did this start? And you talked about maybe depression. If somebody says it started when? I lost my husband, my child, my pet. It started when we had to move. It started when we lost our investments. Then you could say, well, is it related to an emotional stress? We look at every medicine, and we want people to bring in everything. And many times somebody will say, well, I take sleep aid. Well, what's in it? Well, I don't know. It's the drugstore brand sleep aid. We have to know what it is. We do basic blood work to check thyroid, B12, vitamin D, liver, kidney, sugar, brain imaging. And if there's a chance of a sleep apnea, then we'll do a sleep study. It's basically a dementia workup before there's dementia.
Yeah. And I've heard you say, and I'll ask too, when people call, well, has there been a brain injury? You know, has there been something that might have caused this? You know, or has there been a fall? Has there been something that has triggered this? Whatever. You know, you talked about deep diving into the symptoms and their ability. You know, look at their pills, but we also look at their bills, their pills and their bills. You know, are the bills getting paid or are they piling up? You know, are they taking their medication like they're supposed to? Are they forgetting that and taking double doses at one time? Is it being taken like it's supposed to? You know, we ask those questions not only to the patient, but we'll ask the family member. You know, because we want them to be aware that could be a problem. Almost like we deputize them. We ask them to go, you know, okay, you've been in charge of this to Snoop. You need to be aware that this could be a problem. You know, they may further along in this memory loss, and it may be a full dementia, but we've got to find out.
Because the family doesn't realize until they really look at it and say, yeah, you're right. Mom wasn't baking that pie with the ingredients like she used to. We use the word struggle. Are you having struggles with the computer, the TV remote, and being overwhelmed, disorganized?
And, you know, we've talked about this in the past, and sometimes families don't want to see it. So they make up excuses for it. So that's the other flip side of the coin. At least you know, as we know, that's always an option,
opportunity.
A possibility. Can't think of the right word. There you go.
And we'll ask about driving. You know, they struggle driving. And, you know, have you looked at the car? Are there any dings or, you know, if they have any, you know, and then, oh, yeah, they did it took them an hour to come, you know, they went the wrong way and this sort of thing. So when we start asking those questions and start peeling the layers off the onion, the light bulb does come on and there's not that hiding anymore. It all comes to light.
Yeah, absolutely. So what happens when you do all of this testing, have these conversations with the families, and you're finally looking at getting that diagnosis?
First, we need to name it and claim it. People are often relieved when we say, okay, this is mild cognitive impairment. There's something called a FAST score, which is the functional assessment staging tool, and it's for judging normal aging, MCI, and then full dementia. And we hand this to people and say, where do you think that you're at? And they will point out to us, so we're here in this MCI level. There's some problems with organization. We notice, loved ones notice that you know, they're not quite as together as they were. There's a personality change. But now we can do something about it. First is getting educated, understanding what's happening. As always, diet and exercise, good healthy diet, avoid the toxins, avoid alcohol, stop smoking. There are diseases that predispose us to the mini strokes later in life, like diabetes, high blood pressure, cholesterol. We've got to get those under control.
Okay.
You know, and you mentioned about medication. I want to mention in here about illegal drugs.
Yeah.
You know,
we're seeing more and more of that.
We really are. And misusing pain medication and the anti-anxiety medications. You know, we don't think about that in our seniors, but it's there. Even the medical, marijuana or that sort of thing, because we're seeing a whole generation that are aging into it, if you will, and it's having an effect on them. It's having an effect on the brain. It's having an effect on the body, and you know, and it's having an effect on the mind.
Yeah, the partying in your 30s and 40s is catching up now.
Absolutely.
At that time, your brain was resilient. It could handle that damage, and but now the brain's becoming, it's smaller. Our brains atrophy. They shrink as we get older, just like our muscles shrink. And so now the damage that it coped with before, it's not anymore.
Exactly.
Wow. I did not realize that. That's something, that's like a whole, that could be a whole new podcast, ladies.
Yeah.
Okay.
There's lots of research going into it. And yes, the marijuana, because people will say, well, is marijuana good for people with dementia? And I'm saying there is no study that says marijuana makes you sharper,
Right.
and more focused on the details. It just
Right.
But we need to be mindful. Mindfulness, be mindful of the person, of what their needs are, and get focused to what, in talking to someone that has MCI, to be focused on what the task is. And, it used to be that you multitask to accomplish what we needed to. It's been proven that multitasking does not work. So a place for everything and everything in its place, and be mindful of what you're doing. If you're sitting down to pay bills, you sit down to pay bills. And then the same thing with setting up your medication. Get the family involved. If it's, I don't want to bother my son. He's very, very busy. He has a very important job. Yeah, and his new job is going to be helping you out.
Yeah.
And, and that's what I do in talking to families, is that I empower them to be there and help out, and trust that the son, daughter, whoever's the best one to do that, or if it's a friend, or if it's getting hired help to come in there and do that. Get organized, get organized, because if you've got papers everywhere is going to make it worse. Makes it very, very worse. But get help in there.
Yeah.
And a little more on mindfulness, because there's whole books on mindfulness, websites, and you train yourself to be present with what you're doing. Because so many times we're ahead of ourselves. We're thinking that I have to get to the drugstore, and forgetting, did I lock the front door? So some people will turn the key and say, I'm locking the front door, I'm locking the front door, I'm locking the front door. So you remember as you're driving down the street, yes, I locked the front door, rather than get distracted. Focus on what you're doing. There's little exercises they do, like unwrapping a piece of candy, but let it take a minute. Do you know how long a minute is?
It's a long time when you're unwrapping a piece of candy.
It really is.
Yeah.
But you're thinking about, what is the printing on the paper? What does it smell like?
Yeah.
And then focus on one thing at a time. And this is the time, to get the family involved and say, you know what? Get them on. And of course, we're not lawyers, and, get some legal help, but who should be on your bank account? Who should take over if you need it? Who's your power of attorney? Who's your healthcare surrogate? Make those decisions now to designate this, so that when you have a problem, somebody is going to be standing there.
That is so important. And I do have the saying as well, bad news doesn't age well, or doesn't age any better with time. Yeah, my saying doesn't sound very good when I can't remember what it was. But basically, it doesn't, just because you put off talking about it, it's not going to get any better. So I agree. And especially with the legal documents, just get it done. I mean, it's to put it off is just, it's like that. We talked about this in a previous podcast. It will every day bother you till you get it done. And then you'll think, why didn't I do this sooner?
Yeah.
I mean, just get it done. Don't put it off. Procrastination with that type of thing is never gonna, it's not beneficial. There's nothing, you're gonna have to do it one way or the other.
Yeah. And nobody has time to do these big important things that are life changing. Because we have to get to the store, and we have to watch this TV show.
Yeah,
well, and
get that colonoscopy.
Yes.
And and the thing is, it's not going to get cheaper if you wait 2 or 3 years. If you think it's too expensive now, if you're waiting 5 years, it's not going to get less expensive in 5 years.
No.
And and the cost is priceless if you're giving that gift to your family. You're giving that gift to yourself. It's priceless.
Yeah.
And that document is priceless when something does happen to you, because none of us are getting out of here alive. And it's a gift you're giving your family to have that in place. Because I can speak for myself.
Yeah, because they're not making the decision for you. You're making your decision now.
Exactly.
And what keeps a lot of people from coming in is they're afraid that I'm going to look them in the eye and say, well, you have Alzheimer's. No, you have mild cognitive impairment, and here's what we can do about it. Maybe it was a side effect of a medication with some depression. Maybe you need a little therapy to process through some stress. Maybe you
so to caveat into that, what are the treatments?
We start, of course, with non-pharmacologic treatments.
Okay.
The healthy lifestyle, exercise, no toxins. Some people want to try supplements. And I'll always tell them, if you want a supplement, you call me and tell me what it is. Because I'm going to look up what's in it. Because so many of the memory aids are caffeine and aspirin.
Okay.
Or some other kind of blood thinner.
Okay.
That may or may not do you any good and may do you some harm.
Okay.
Or the patient can look up, what are the ingredients? I know they promise everything in the bright, shiny ad, but what is it really that you're putting in your body? Other people who say, you know what, I have a high risk for developing Alzheimer's or vascular because my mom did, my brother did. They want to be started on the prescription memory medications now.
Okay.
And we'll say, you know, if you have a car that's rolling downhill, do you want to put the brakes on at the top of the hill or the bottom of the hill? They might say, I want to actually start something now to maintain at this level.
Okay.
Very individualized.
Yeah.
Wow. So I didn't even know that that was an option. So that's really good. That's a good conversation some people should be having if they've had family members with.
Yeah, and following the memory testing, you know, there's nothing wrong after the illness. You know, there's just manage their stress. You know, we teach them how to, you know, I'll give them coping mechanisms, you know, of the breathing. And also, if something happens, if they have a medical condition with a surgery or something like that, it may make it worse.
Well, yeah, these are the folks who have delirium is acute confusion brought on by a physical problem. So it's almost like psychiatric symptoms, hallucinations, delusions. After surgery from the anesthesiology and the pain meds, urinary tract infections, just severe stress can induce a delirium. Who gets delirium? People with dementia and people with mild cognitive impairment. And it might take them to that next level. So we do follow-ups, memory testing. What are your abilities? What's going on?
But it's really interesting because I've seen so many people that have came in and they've got that little brain fog and they're just really scared. But once they hear, well, it looks like it's mild cognitive impairment, this is what I would recommend you do. They're really, really don't need a medication right now. This is what you can do to take control. And it's like they grow a foot and they have pep in their step and this sort of thing. And they're so relieved that the brain scan was good. Their testing was good. This is what they can do to make changes. And they're so relieved at what Dr. Trinetti has told them that when they come back in 6 months, a year, or 6 months, and the testing has actually improved because they followed what she recommended, the healthy diet, the exercise. They stopped smoking, they stopped drinking, they stopped the things that was causing the fog, the disorganization, this sort of thing. It's like, wow, they really listened and they really put into action because they wanted a difference in their life. And it was, I mean, it's amazing. It really is amazing.
Yeah. So to kind of wrap things up, I want to kind of point out the fact that this is not a bad diagnosis. It's not something that people need to freak out and be fearful of, because there are different ways to treat it, different ways to really it's not something to be fearful of, I guess is what I'm kind of getting at.
Yeah, I'll say we're waving the yellow caution flag,
Right.
not the bad red flag.
Not the freak out flag. Yeah. So I think those are good notes to it's a good takeaway from this. So, to hear MCI, almost dementia, it's not something that you kind of have to freak out about. Just kind of take it and go with it, get the right diagnosis, and then kind of make the decisions and do the lifestyle choices and whatever your doctor recommends in order to kind of move past that.
That's a great summation, darling.
Yeah.
It really is.
So there you go. It happens every
You
once in a while.
learned a lot.
It happens every once in a blue moon. So, well, thank you everyone for joining us on this episode of SeniorLivingGuide.com podcast, and we look forward to many more.
How's the retirement home search coming?
Oh my gosh, I'm just so stressed out. I don't even know where to begin.
Well, why are you so stressed? What's the matter?
I don't know where to find anything. I just need everything in like one place and know what all the options are.
Does the idea of searching for senior housing seem overwhelming and you just aren't sure where to even begin? SeniorLivingGuide.com has great news for you. We offer a one-stop solution to take the stress out of your senior housing search. At SeniorLivingGuide.com, both our statewide Florida edition book and website are created to make your senior housing search very easy for you to navigate. We provide details on communities, including retirement, assisted living, skilled nursing, memory care, and home health, allowing you to decide which best fits your needs and then connecting you directly with those communities. Visit us online at SeniorLivingGuide.com and start your search today and start de-stressing.